All right, everybody. Okay, so let's go ahead and talk about this passage 6 here that we've gone ahead and gone over. Everyone's had a chance to go through it. So let's talk about technique, right? We've talked about different question types that you're going to be encountering, stuff like that. So we want to kind of look at those in terms of what question types are getting me more, what question types are getting me less, and also how can I be more successful with these, okay? So let's go ahead and talk about our overall technique. As always, you want to rank this as a now or later passage. So considerations here is that you have 4 paragraphs. Reading, you can kind of characterize each paragraph fairly quickly, so you don't necessarily have to get into some hardcore details necessarily. And you've got 1 graph to understand, okay, with only 2 axes and 4 different patients on it. So you can maybe rank that as maybe, depending on how it is for you, now or later. I personally would say now, because the question yield on this is 6 questions. And 6 questions, that's a pretty darn high yield. Okay? So, highlighting. First paragraph, of course, I would have gone through and highlighted that this is obviously about lung diseases. So we know we're going to be talking about the respiratory system. And so if you feel good about the respiratory system, this might be something that you want to go ahead and tackle. Alright? They go on to tell you about these different diseases, and they're because of different inhalations of dust and fumes, etc. So you see also mentioned here as the causes of these different diseases. And then you see at the end of it, they kind of break it into 2 different types. Restrictive versus obstructive. Okay? And so they tell you that, of course, with mineral exposure, you got mineral dust. And this is something I would jot down on my scratch paper, because they're going to start building connections on this one, so it's good to see it on your scratch paper, so it's there for your connections to be built from. So mineral dust, they tell you, that's, of course, going to equal a restrictive disease. Equals restrictive. I'm going to leave a little space to kind of highlight some more about restrictive if I need to, because they're probably going to build on it. Then, of course, you also see that they talk about the chemical agents tend to be obstructive. So chemical equals obstructive. All right, they give us a little bit of detail about those. That, of course, with a restrictive, it's restriction in the overall lung capacity. So with restrictive, you see a decrease in your lung capacity. With chemical obstructive, it's obstructing the flow. So, of course, in those, you're going to see a decrease in flow. All right, a decrease in flow. Then, some highlights I would have made in, of course, the second paragraph. So this, of course, was paragraph 1. Paragraph 2, some highlights I would have saw. Of course, we're focusing now on a specific disease, CWP. Okay? This co-workers, pneumonia, blah, blah. Okay? And that this, of course, they tell us is restrictive. Alright, so I would have highlighted that. And maybe over here, kind of noted, that, hey, guess what? If there's something about CWP, make sure to put that under restrictive. So then I would have jotted down on my scratch paper. Now, as far as the different highlights from that, things I would have kind of checked out, I would definitely highlighted that you had the macrophages, what their role is, and that, of course, the macrophages, once they're going in and doing their business, they're going to go ahead and basically become these nodules, become this fibrosis, these fibers. So these macrophages eating that coal up, resulting in nodules. A couple things I would have highlighted there. Then we get into our third paragraph, and they talk about the 2 groups. Okay, so paragraph 3, I see that CWP, and we've got simple and complex. And of course, we're just trying to find location, so now I know where if I need to go into the details of simple complex, I'm going to go there for paragraph 3. Okay, I'm going to wait and try to get into any more of the hardcore details until I get a question about it. So over my scratch paper, I'd probably go ahead and throw in a simple versus complex. So if I need to build a table on those or something, it's there for me. All right. And finally, the fourth paragraph. Lung diseases are assessed by the measurement of volumes during inspiration and expiration. So, of course, paragraph 4, your lung assessment. All right, how are you going to assess the lungs? So your lung assessment. All right, you see, of course, there that they talk about different flows. So it's kind of maybe a good idea, because we already kind of see that they talked about lung capacities, etc. this gives me a little bit more about those. They tell me more that obstructive disease is not only a decrease in flow. In obstructive diseases, you will see an increase in also the lung capacity and an increase in residual volume. Okay? Then they go on to tell you that with restrictive diseases, you see the opposite, a decrease in lung capacity, which we got from the first paragraph, but also they tell you now a decrease in residual volume. But further, an interesting thing they tell us is there is no effect on the flow. No flow changes. No flow change. All right? So it's kind of just building on what's going on with those two different types that we're discussing here. And lastly, we see our actual graph. Now, this is again a good example of them being sneaky on the graphs. Okay? In the graph, if you notice here, we of course are looking at some different patients and their little kind of like states here. And if you notice that they see that over here, for example, is a TLC. Here is a residual volume. Okay, total lung capacity, residual volume. And that, of course, here, as you would expect, you have flow increasing as you go up the y-axis. But here's the trickiness. Look how they're doing the volume. Okay? Sneaky, sneaky. Volume is increasing to the left. Increasing to the left. Tricky, tricky. Because you would think it should be increasing to the right like we always do. So watch out for that. That can be a slip up later on. Now, questions on overall highlighting and scratch paper here. Okay? Things we would have jotted down on our scratch paper. Okay. Let's jump into the questions then. Alright? Let's go and start with question 1. Now, if you see question 1 is a 2 by 2. Alright? You see that in the answer choices you've got parasympathetic. So para here, and then sympathetic and sympathetic. Okay? So 2 by 2. Now they tell us, of course, it looks initially kind of long, that they're talking about the agonistic drugs and antagonistic drugs, and tell you that agonists increase, antagonistic decrease the response. Which of the following drugs would be best to treat the occupational asthma? Well, if we go back into our passage, they told us that, of course, occupational asthma, that was going to be a chemical or obstructive type of disease. Think chemicals, right? Occupational asthma. And you're seeing a decreased flow. So a decreased flow, increased lung capacity, and residual volume. So the flow is kind of the problem here. So if you think about it, parasympathetic is rest and digest. Sympathetic is our, of course, fight or flight. Which of these two systems is going to want to increase airflow? All right, when would I want to have an increased flow through the lungs? Parasympathetic, rest and digest? Nope. Sympathetic? Yes, I would. Now, do I want the sympathetic system to be an agonist or an antagonist? Act with or against? Well, I want it to open up the lungs, right? If you have someone who has asthma, those are like those bronchoinhalers tend to be what are called sympathomimetic drugs, or mimic the sympathetic system. So, we want it to act as an agonist. So, sympathetic agonist. C is our correct answer. Questions on 1. Alright, questions on number 2. Let's look at this one. So Q2, of course, that wasn't an implicit. I'm going to go and call it the kind of question it was. You had to work through some things there. Now, question number 2. Alright, I would also say is perhaps an implicit. Okay, they tell us that you have this new thing you didn't see discussed in the passage, FEV, which they define as the measurement of the total volume of air that can be forcibly exhaled in 1 second. So how much air can you breathe out in 1 second? Okay? So, after a complete inhalation. So you breathe in, and then how much can you breathe out in 1 second? How fast can you breathe out air in 1 second? So, think about that. That's a flow thing. So, you can maybe skip it, alright, because you have to kind of do some, a little bit more work on that. Some new factor and whatnot. Alright? But we'll come back to that a little bit. Question number 3. Question number 3, of course, this is an explicit. Okay, coming right out of what's going on in the passage. We say, which of the following would not be associated with complicated CWP? So remember we talked about complicated CWP down here in paragraph 3. So we go back to paragraph 3. Look where they talk about it. Simple, they say early chronic exposure to coal dust. You see small nodules between 5 and 1 centimeter. And then similar to those in cigarette smoking. But then upon a continued exposure for 10 to 15 years, simple becomes complicated, and you see the lung nodules are anywhere from 1 centimeter to the size of the entire lung lobe, so they're much larger. You see that you have significant reductions in lung volume and gas diffusion and capacity and premature mortality. And albeit hypoxia can lead to pulmonary vasoconstriction, and complicated CWP could also be associated with right-sided heart failure. So, we see that, of course, answer choice A. Remember, we're looking for this as a least not except. So watch out for that. Least not except. We're looking for the not. So A, complicated CWP, lung nodules 2 to 3 centimeters in diameter. Well, those are greater than the simple. So that one does check out as true. Okay? A good technique on the least not except is to put true or false as you go through. So that was true. B, decreased pressure in the pulmonary vasculature. So they tell us at the very end there that you're going to have right-sided heart failure because of the increasing pressures, not decreasing pressures. So B is false because they say decreasing. So that may be the answer choice. Double check the other ones. C, right ventricle hypertrophy. So the right side is becoming larger because it's having to push against more pressure. So that checks out as true. And finally, D, granular blackened areas in the lung. Yeah, remember we talked about the macrophages and the nodules because of that? Yeah, that's going to be there, so that's true, leaving us with B as the correct answer. Questions on 3. All right, number 4. We see another kind of bigger one, but if you notice, this is a 2 by 2. So remember, when you have like a 2 by 2, even though if they're bigger, it may make more sense to kind of just go ahead and tackle it. So of course, question number 4, 2 by 2 again, that we're looking at. And they tell us, okay, botulism is a type of food poisoning which a toxin release of the bacteria, Clostridium botulinum, inhibits the release of acetylcholine. All right, so this is going back to acetylcholine. Remember, acetylcholine, or nervous system neurotransmitter for the somatic and for the parasympathetic. So acetylcholine, okay. In motor neurons, they go on to tell us. So this is somatic, motor neuron somatic. In severe cases, this can lead to paralysis of the diaphragm. So the diaphragm stops moving. Which of the following would be expected in an individual suffering from severe botulinum? So basically, we're not moving. Now, if it's not moving, is it a problem of flow or is it a problem of capacity and volume? All right, it's just stagnant. We are paralyzed, right? The diaphragm is paralyzed here. So, would I have, we see, in A, decreased, of course, they're talking about decreased lung capacity, LC, or would I have an increase in LC and LC? Now, if you think about it, our diaphragm is paralyzed, it's not moving, so am I bringing air in, or is air just, boom, where it's stuck at, right? So we're not increasing the capacity here, we're going to have a decrease in capacity, C and D are out. So we've got A and B, a decreased lung capacity. So then we go on to see the next conditions, one says decreased residual volume, normal flow. The other one says increased residual volume and decreased flow. All right? Now also think about this. If I'm activating, right, what's going to be happening in terms of the flow, right, the diaphragm is paralyzed, can I have that flow in and out? Am I going to be able to see the flow here? Because they say decreased residual, increased residual, normal flow, decreased flow. Now if I'm not able, if my diaphragm is paralyzed, basically what's going on with all my air in there, right? Am I ever pushing anything out? Or am I going to have an increase or decrease of residual volume? We're going to have, of course, in this case, a increased residual volume. So increased residual volume versus a decreased residual volume. It's all kind of residual. A is out. B is our correct answer. Questions on 4. All right. Number 5. Number 5 is a straight out memory question. Okay, just straight out memory. All right. This, of course, is definitely an implicit one here. Now, in number 5 here they say, of course I haven't got that one yet. Which of the following statements about the respiratory system is true? So it's what do you know about the respiratory system? A. The ratio of cartilage to smooth muscle decreases as the bronchial tubes branch smaller and smaller. Now that, if you don't remember, that is a true statement, right? Remember, the upper respiratory tract is going to be mostly cartilage to hold it open, but as you go lower and lower, it's going to become more and more smooth muscle. Less cartilage, more smooth muscle. Or as I say here, the ratio of cartilage to smooth muscle decreases, because there's more smooth muscle, as the bronchial tubes branch smaller and smaller. A is the correct answer. All right, that is a true statement. Okay? We're seeing that increase of smooth muscle and a decrease in cartilage as we go down. Then you have, of course, B. Respiratory zone participates in gas exchange only, whereas conduction zone participates in both ventilation and gas exchange. Remember, gas exchange is only in the alveolar ducts and alveoli. So that is incorrect. Not in the conduction zone. Right? No gas exchange in the conduction zone. Then we got C. Contraction of the diaphragm is mediated entirely by autonomic. Take a deep breath right now. All right? Did you just consciously control your diaphragm? Therefore, what kind of muscle is it? Skeletal muscle. So it's somatic neurons with this weird hybrid function, of course, of autonomic control, not autonomic control, but an autonomic function, and that you don't have to think about it. But it is skeletal muscle. All right? It is skeletal muscle. And then finally, you look at D. An increase in carbon dioxide leads to accumulation of carbonic acid, a decrease in blood pH, and a decrease in the ventilation rate. Now, hopefully you remember the whole Uber equilibrium equation. You know, water plus CO2 becomes carbonic acid, becomes hydrogen plus bicarb. Now, if we see, of course, an increase in the carbon dioxide, this is going to cause a buildup, Law-Charlier's principle. You shift, of course, towards more acid. You would have a decrease in pH, but that would lead to an increase in ventilation to get rid of the CO2. Respiratory compensation. So that's a problem with D on number 5. Questions on 5. All right, 6. Which of the patients in Figure 1 is most likely suffering from CWP? So we go back to CWP. It says it's restrictive. Restrictive here means a decrease in lung capacity, a decrease in residual volume, but no flow change. So we go back and look at our graph, and you see that the only one that doesn't have a change in flow, if you compare the solid black line, which is normal, to the dashed line, which is patient 4, there's no change in flow. Now remember, we're going to see a decrease in lung capacity and a decrease in residual volume. But in this graph, remember, going this way is a decrease, and you see that the one for patient number 4 has a decrease in lung capacity, decrease in residual volume, since the volume is going the opposite way. So, of course, D is going to be patient 4. Questions on number 6. All right, let's go back to number 2 now. It's a little bit harder of the implicit one, and it's, of course, a Roman numeral. So we got Roman numerals 1, 2, and 3. Now remember, with the Roman numerals, you want to go ahead and find an answer choice that has one of the Roman numerals twice, because that knocks it down to a 50-50. So they tell us, again, back to that FEV, and it's the amount of air you can force out. So this is a flow thing, right? So think, of course, FEV, that's a flow issue. All right, issue with flow. So they tell us here which of the following conditions would be reduced. When am I going to see a reduction in flow? So the first condition they tell you here, and we look at 1, and 1 is in 2 answer choices, so that looks like a good start. CWP. Well, CWP was restrictive. Restrictive does not have a change in the flow. Alright, so there's no change in flow, so we get rid of 1 because there's no flow change. So that, of course, if 1's gone, that gets rid of A and D. Now, if you notice, in both B has 2, C has 2, so I know that Roman numeral 2 has to be true without even having to read it. And it is. It tells you occupational asthma. Remember, occupational asthma, of course, was obstructive. And then the next one, chronic obstructive pulmonary disease. I think it says there in the title, obstructive. And so we're saying 2 and 3. C is going to be our best answer. Questions on those, anybody? All right. Thank you so much.